Okay, welcome everyone. This is Dr. Duke Majin, and this is our third and final surgery for the day. We are getting ready to perform a Duke laser disc repair. Sean, can you hear me okay?
Yes, now I can.
All right, sorry. Dr. Duke Majin. We are here on March 3rd, 2020. Thank you. This is our third and final surgery for the day. We're broadcasting live from Duke Spine Institute. Thank you to the support of the foundation, Duke Spine Foundation, for research and education, providing us the resources to be able to broadcast live surgery so that you all can listen and ask questions and watch and see how we do spine surgery. We have the distinct pleasure of working on one of our veterans today. Our patient has had a spinal fusion done in the past in his back. And you're going to be able to see those screws and rods and cages. I don't think I did this surgery. I didn't do your surgery, right? Yeah, I didn't do his original surgery. But now he's developed what's called adjacent segment disease, where there's a problem now above the fusion. And then there's a herniation on both sides. So I need to get in there and try to unpinch the nerve so that he can walk better, right? Okay, you're going to be awake for the first 10 minutes, then I'm going to put you to sleep. If you have pain, just say ouch. If you're having any pain, say ouch. All right? And I'll give you some more numbing medicine. Don't try to get off the table and help me, though. All right, just lay still and we'll be done before you know it. Okay, that's my hand on your back. I'm going to give you a little stick and you'll feel some burning. That's just the numbing medicine going in. All right? So don't get angry with me for numbing you up. This is the worst part. This first 10 minutes, you're not going to like me. And now the other side, you're going to feel the same thing. Okay, that's normal. That's just the pain medicine going in, okay? Well, can you talk to him for me then? Just, you think he understands what I asked of him? Yeah. All right. You're doing great. Everything's okay. Just lay still, okay? All right, we got a shot. Beautiful. Give me a lateral view. Oh, I'm talking to the audience and my team. Don't worry. You just lay still. I'll be sure that the anesthesiologist whispers in your ear when we need you. All right. I agree. He better. All right. We got to drop the table a smidgen. So you all can see the screws and rods from the prior surgery. I knew that that wasn't mine because I always use a cross-link. Cross-links basically stabilize the rods from rotation. All right, watch the scope, please. I've got to get in here and try to get us to where we need to be. I think I need to be a little bit lower. Let me have some more numbing medicine. Uh-huh. He may not feel this one. I'm going to go in where it's numb. But he may feel the burn. Yeah, everything's okay. That's just me numbing you up again, okay? The right side hurts. I didn't put, oh, right then? But it's gone now, right? But that pain is gone now, right? You don't have the pain on the right side anymore, correct? Yes. Okay, but you don't feel that anymore. Yeah, I took it out. It was just there for a little while. Shot? All right, so I'm heading to the L23 disc right above the fusion. You're doing great. Probably need to be just a tiny bit lower in my approach. Shot. All right, shot. So a lot of scar tissue. A lot. Where'd you feel that? In your back? All right. You better? All right. There's a lot of scar tissue from your old surgery around here, so just bear with me, okay? I apologize. Shot? You want to give them something to make them more comfortable? Let's get an AP view and see where we are. I need my mask pressed down, my tape, right side. It's just steaming up a little bit there, yeah, that's good. Yep, that should be good. All right. So, okay, yeah, we're right near the metal. Let's go back to a lateral view. By the way, if you're watching, you noticed today that we had difficult surgeries, all three. We haven't had a single easy surgery today. Now, we don't want to break with that tradition. All right. Shot. Shot. I'm hitting his facet joint, which is fine. Shot. Yeah, I know, it's uncomfortable. Just give me a second. Bear with me. That's the facet joint. All right, I'll numb that up just a little bit. Give me some numb. Take. I can't do too much because the nerve is here, but that would be bad. Hopefully that helps. Shot. That's looking good. Shot. You're doing great. Just lay still. We're going to be done before you know it. Yeah. Where do you feel that? Your hip? It's okay. Everything's okay. Yeah, I need you to help me out with some of this. You're doing fine. That's just your facet joint. It's got some arthritis in it. It's pretty sensitive. All right, anybody know what that is in front of the spine? Not the anesthesiologist. Anybody out there? The top screws. Follow the trajectory out, and it looks like a little, anybody see the movie The Matrix? Right? What is that thing? Let's see if any of our audience knows. Let me know when I can proceed, by the way. You're not allowed. You're not allowed to answer the question. Okay? You're a nurse. So let's see if any of our online guests know what that is. Do
We have a guess.
Okay.
Someone guessed a catheter.
No. Good guess, though. It's definitely not something that's normally there. Are you comfortable? You guys see it? It looks like one of those little, what are they called from the Matrix? Those robotic things that, you know, there's a name for them. Oh my gosh, are you kidding me? How could you guys not know? Should I proceed?
Hold still, Robert.
Sentinel. They're called sentinels. That's what they're called, sentinels. All right, a lot of bone here. Shot. Yep, right there. Just hang in there, Robert. We're almost done, I promise. A sentinel. Shot. Yeah. That's not a sentinel, by the way, folks. That is a, it's called a green-filled filter. It's for people that have had a deep venous thrombosis. It basically catches blood clots and keeps them from going up. Whew, tight. Anything you can do for me? Not yet. Well, we definitely got in, so I'm happy about that, Shot. Just relax. You okay? Just lay still. Try not to lift your back up, okay? That's not helping me. Just lay still. Now we're going to go on the opposite side. What? We're going to go on the opposite side now. Same thing. Yeah. You're doing good. Just lay still. Shot. Sentinel. If you haven't seen The Matrix, if you're out there and you haven't seen The Matrix, did you see The Matrix, Colonel? The movie The Matrix.
Did you ever see the movie The Matrix?
Uh,
Keanu Reeves? No?
Great movie. You would be impressed with some of the technology they have, military technology. Just lay still, you're okay. I know, it's the worst part. Hang in there, Shot. Anything we can do to help him? Lay still. Huh? Shot. You're doing good, just lay still though. I need your help. I know I'm asking a lot. Trust me. Shot. Almost done. Everything's going good. I know. Okay, I apologize, Shot. You having any pain in your back? Shot. Yeah, just your back, right? We're gonna put you to sleep in a second. I just need you awake. Shot. Alright. Yeah, so normally there's enough space there, but the fact is the patient's super clamped down. So he's like tightening up his back muscles and he's grasping down on my needle. So this needle is 1.5 millimeters. It's nothing, right? But when you clamp down, forget it. It's not going to happen, but it's going. Just it's taking time. Shot. That's it right there. Bam. Oh. What do they say? It's better to be lucky than good. All right, sir. Are you comfortable? Give me an AP. You don't know? All right, we're going to put you to sleep in about 3 minutes. I just need your help. Now, this patient told me in clinic he doesn't have a lot of back pain. My God, look at that. On a scale of 1 to 10, that's a 9 disc, a 9.5 to get into. So we're very fortunate. Are you comfortable? All right. Is that where you typically get your back pain? I know, I had to test it. Is that where you get your back pain? Is that where you normally get pain in your back? I can't hear what he said. Sir? Yeah, but when you get back pain, is that where you typically get it? How bad was that on a scale of 1 to 10 at its worst? How bad was that on a scale of 1 to 10 at its worst? How bad was it? 9. All right. You can put him to sleep. When you wake up, sir, we'll be done. You're going to be a new man. The bionic man. All right. Sounds good. Count from 1 to 100 for me out loud. Count from 1 to 100 out loud. Lateral. If you get to 100, we don't pay the anesthesiologist. I don't know why, but I say that like 100 times. It's still funny to me. Right? All right. Can you push my mask? So, everything's gone quite well with this patient. I feel really happy because it could have been a lot harder. His disc has collapsed. His biggest problem is his legs, and the herniation that we're about to fix is pushing on his nerves coming out of those holes right above his fusion. So we're treating what's called adjacent segment disease. It's herniated disc above the fusion or below. In his case, he doesn't have a herniated disc below the fusion. His disc below the fusion is perfect. It's not herniated. It's nothing wrong with it. So all of his problem is happening above his fusion at L23 and L12, which we're not treating today. Shot. Shot. All right, very good. Now, you see that? He's got blue blood. You like that? That's right. He's a blue-blooded colonel. Honestly, though, I feel a tremendous sense of honor and privilege to be able to take care of one of our military personnel. We have a lot of them that come here, and it's really nice to know that they trust us. And we do our absolute best for everybody. We don't discriminate. And it's just nice to know they come here and they want our help. Shot? All right, so I'm following this guide wire down with my dilator. So if you watched all the surgeries we did today, then number one, you gotta check yourself in. But no, seriously, that's a lot of surgery. You got a lot of free time. But we did a lot of surgery today, and you deserve like a brownie badge or something, right? For staying awake. I mean, I couldn't watch all those surgeries myself. I'd be bored out of my mind. I'm one of those kind of people that has to do the surgery to actually stay interested. I could never watch soccer, you know? I had to play soccer. I couldn't watch it.
I couldn't watch soccer
How's our BP? Good. All right.
either. Light taps.
Light taps from my anesthesiologist. Absolutely. I do requests. So we're right at the back of the disc. And remember, the disc is collapsed, and having this patient sleep is going to help me because I'm going to be able to get in better. Shot. Yeah, he's not happy. Want me to wait? Yep, no problem. So from a surgeon standpoint, right now, if the anesthesiologist can get the patient to where they're really comfortable and they're not feeling pain, then I can get my dilator in there easily. On the other hand, if the patient's like feeling pain, they're going to tighten up and spasm their back, and that clamps down on the disc and it makes it harder for me to get in. So I'm going to give the anesthesiologist all the time he needs to get the patient comfortable, so where they're feeling a minimal amount of discomfort, so that I can do this without, ruining the end plates. Any questions from the audience?
None so far.
Everyone see the sentinel in front of the spine? So I can mess around with you and I can tell you that that's a sentinel in there from the movie The Matrix. Maybe some of you watched that movie, you wonder where the sentinels went. This colonel has one in his body protecting his spine. Just keeping an eye on me. You like that? Now everyone's going to have to go watch the movie The Matrix. Honestly, one of my favorite series of movies ever made. Second only to Star Wars. The original 3. Are we ready? All right. I'm coming out with the guide wire. And perfect. Shot? Yes, we're in like Flynn. You see how nicely that went in without him tightening up? I didn't have to really hit it too hard. All right, so for those of you who have never seen the surgery, this is like space age spine surgery. This is the most advanced spine surgery in the world. That's why we broadcast it. We want everyone to see what can be done. All right? It's kind of like when the military releases those videos of their new weapons, and they're like, hey, take a look at what we've got. They usually show you stuff, though, that they've had for 50 years. They're not going to show you the newest stuff. But the point is, yeah, we've had this for 15 years, but we do the whole surgery through this too. But there's nobody else really in the United States that does this. There's only a couple of us, a handful. And nobody does exactly what we do here because no one else knows they have to repair the annular tear. There's only 5 of us, and I know the other people who do it. And they don't do what I do. They're more focused on the herniation. So they don't cure back pain like I do. They only help people with leg symptoms. Now this patient has mostly leg symptoms, so their surgery might be fine for him. But the other thing that I do at Duke Spine that nobody else can say is we've had 0 complications to date. All right. All right, so we're right at the back of the disc and we're going in. Shot. Uh-huh. We're advancing the dilator. So I need to pull back. Something you want to watch out for if you do endoscopic spine surgery, you don't want to advance your dilator past the anterior border of the disc. And we got lucky. Shot. It's perfect. Keep him nice and comfortable. Let's get the fluoro out. Watch that. We're actually going to go on the other side because this patient has leg pain on both sides. So we're going to do both sides. I'm decompressing the nerves on both sides.
Scope on, please. Lights out. Candle, right? Okay.
Now I got to give credit to the surgeon who did his fusion. I don't know who it was. Anybody know where he got his fusion done? But the surgeon did a nice job. All right, I don't normally feel that surgeons do a good job, but what I can tell you is when I look at his spine, he has good alignment. It's not great, but it's good. Watch your head. There's no way. I mean, Pat Jacob could do good work like that. Okay, I admit he could do good work like that. But the surgeon did a good job because he's got a nice lordotic curve got perfect screw placement, like perfect length, and everything, the hardware looks good. I think the surgeon did a really good job. Okay, and I'll be honest, I don't normally compliment other spine surgeons' work because there's nothing to compliment. But this surgeon did a good job, whoever it was. I don't think it's me because I always put a cross-link in, but there's a few cases I didn't. But I think this guy had his surgery done elsewhere. So he must have had a good surgeon, though, that's for sure. But, you know, even though the surgeon did a good job, his patient still developed a herniation above his fusion. Why do I have so much bubbles? We have,
To change,
no, we just started. I don't know, it's just weird. Shouldn't have this much bubbles. It's better. Wait a second. I mean, we got good pressure, right? It's strange. All right, well, we're inside the disc. This is the L23 disc. And remember, we may actually see the needle on the other side, deep inside there. So don't be surprised if you see something metal down there. That's going to be the tip of the needle from the other side. Luis is clucking away over there. So anybody see the movie The Joker?
the new one?
Yeah. Great movie. Great movie. Probably one of my favorite of the year. But I got to say, that movie, Parasite, the Koreans, holy mackerel, that's a good movie. Anybody see that? No? What's wrong with you people? You don't go watch movies anymore? Huh? You don't like scary movies. That's funny. It's not a scary movie. He's moving around. The Joker is very sad. It is so sad because it's so real. We have a lot of people like that. I mean, sure, they don't do exactly what he did, but there's a lot of people who have mental illness that are being neglected by our government, by the insurance companies. It's very sad, but it can be fixed, you know? Stand by. Basically, we cut funding for mental health institutions. I think Ronald Reagan did it. I can't remember who did it, but it was a Republican, I'm pretty sure, years ago. That was a big mistake. You know, we need to take care of our sick. We need to pay for them, help them, rehabilitate them. They can't fend for themselves out on the streets. So the Joker is really a product of our own neglect of people who need help, you know? Gosh, even the most primitive societies, Aboriginal societies, they take care of their sick. They're elder, they're ill. They don't just abandon them. And yet here we are, this advanced society that we're supposed to be, and we just leave people like that with no support. So I think it's a great movie. I think it really brings a light, shines a light on some of the social problems we have right now with respect to healthcare and how we treat the mentally ill. You know why they do it? You know, sad. I think they do it because they realize these poor people can't remember what was done one day to the next. They don't realize just how miserable they really are. It makes me sick, though, when I see the billions of dollars every quarter, every few months that insurance companies make in profit, yet they can't take care of these poor people living on the street that have no ability to care for themselves. We're all so worried about coronavirus. That's making the news these days. Far more people die from starvation, disease, neglect. Nobody's talking about that. We just ignore it. Stand by. As a society, shame on us. Oh, look at this herniation. Oh, oh, mamacita, that's beautiful. We're going to get that out. And that thing was actually what was sitting probably on his nerve in his foramen. I just shoved it back inside the disc. But it's too big to get out. Oh, wait, let's see. We got a piece of it. We don't need to turn the light on. Nope. All right. You can send those. All right, for those of you who have never watched before, you are watching true endoscopic spine surgery. This is the surgery that your spine surgeon wants to be able to do but can't do. Are you back with us, Colonel? Look at you. No, he's not. He's asleep. Gosh, I just can't get it. It's going to come though, don't worry. We're not leaving it here. We're like the Marines. We don't leave anything behind, anyone behind. We're bringing this herniation with us. It's just too big to fit out of the tube, huh? Isn't that cool? Well, we're going to get it. Oh, I got to just wiggle it just perfectly. I need to hear a chant from the audience. I need to hear a go, 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 go. Nope. Huh? Oh, I know. Won't even fit out the tube. The problem is it's so hard, you know. This patient is a bit elderly and this thing has been in here for a while. So it's gotten really super hard. Oh, I think I got it coming. Come on now. Oh, I got part of it. That's a good chunk. Woo! Still more to go. Who knew that spine surgery could be so entertaining? Huh? So who wants to guess how many views we had on the PCDF? How many people saw that surgery? Who wants to guess from here? There it is. Huh? 31,000. No, it's wrong. 800,000? 800. No. You're off a little bit. We had 100,000 views. 100,000 with our first surgery today. I don't know if that's just Facebook or YouTube. Any idea, Sean? Was that just on one social media platform or more than one?
It was our combined platforms altogether.
All the platforms. So Periscope, YouTube, and Facebook. Oh, there's another herniation right there. Stand by. All right. 100,000 views. That's like viral, right? I shouldn't say that right now, considering the virus that's going around. Everybody's pretty sensitive about it. My wife keeps telling me every single day, make sure you talk to Luis. Make sure we have enough surgical masks. I'm like, don't worry. We have enough surgical masks. You were in Walmart? Really? I don't know why people think that Perel is going to save them. There's only one thing that's going to save you people. God. God alone. That's it. Seriously. Perel is not going to save you from getting the coronavirus unless you're snorting it. How many people are snorting Perel? Admit it. Okay. Did you not hear the announcement? Coronavirus is transmitted through aerosol and respiratory droplets, both. That is bad. That means that when somebody sneezes, the little bubbles of moisture and virus stay in the air like a little fog for a few minutes. And Perel on your hand is not going to stop you from breathing it in. I'm not advocating that everybody go out and get infected. What I'm saying, though, is that if the chance that you're going to be able to avoid infection by using Perel is, I think, not true. I mean, if it makes you feel better, by all means do it. But I'm just telling you the truth. Sometimes I tell people the truth and I become very unpopular. That's okay. This broadcast is about the truth, no matter how unpopular the truth is. I'm just curious. Those people that watched us from India and Saudi Arabia, I guess they don't understand what I'm saying unless they have some kind of translation software. I wonder if Facebook or YouTube has a translation software for live streams. Anybody know?
I know Facebook has it. If you write a caption, you can click see translation.
Yeah.
I don't know if they do it.
But that's in writing, right? And that's something written, not spoken in the video. All right. We're seeing the end plates, by the way, and that giant gap down there is where the disc used to be. So this patient doesn't have much disc left, and that's fine. You know, I've told people this over and over again. Not having a sponge in there is not the problem. You know, we're not trying to reimplant a juicy disc in people. That's not going to save you or solve your problem. We're trying to get rid of pain or nerve pressure. Yeah, so I know lots of people that have no disc. Did you pop another one?
No,
I know lots and lots of patients with no disc left, and they have no problems from it. So, you know, putting the disc back in there is not our goal. All right, we're pretty much done with this side. I'm just getting this last little bit. Then I'm going to check the nerve, make sure that the nerve is unpinched. There's nothing else still on it. Any questions from our audience?
We have one.
Perfect.
We have an audience member asking, are you mechanically dissecting the disc with the laser?
All right. So, am I mechanically dissecting the disc with the laser? No. Yes and no. So the yes, well, let's talk about the no first. The laser produces a burst of energy. So we would call it thermally dissecting with the laser. But then the laser also produces a shock wave, a pulse. It's and that's mechanical. And you can see, like, look at this stuff here, right? When I hit the laser, it starts to jiggle and wiggle that's because of the shock wave. So the laser has two effects, thermal and shock wave. And I need both. Yeah, good question. Thank you for asking. Let's see here. So one thing I would love to do is be able to provide this surgery to the military, because our soldiers deserve to have the very best, but the military plays dirty games. Not the military, but TRICARE. Humana does. We were doing all these surgeries on the military, on soldiers, and they were doing great. They love it. But then Humana, who's in charge of the military benefits, played a dirty game with us. They decided, even though they approved in writing 20 surgeries to be done, I hate to use the word, but they reneged on it afterwards, and they didn't pay us. And so they thought we would just go away and not, drop the issue. Well, we spent a lot of money on those surgeries, and there was no way I'm going to drop the issue. Especially since they had approved the surgeries to begin with in writing. So we went and fought them. So they did a sham peer review. They basically got some doctors to say that the surgeries weren't necessary. They weren't helpful. They weren't necessary. And of course, every single patient we operated on got better. So the patients were like, what are they talking about? So they bypassed the patients. They didn't give a damn what the patient said. And they went and they just wrote up that the surgery wasn't necessary. So when I asked which doctors these were, I found out that the head doctor was a doctor who does cancer treatment in children. And they got tired, wanted to retire and just have easy money. So he would work for Humana and write up these opinions that he was not even qualified to write as a pediatric oncologist, saying that spine surgery wasn't necessary in an adult. That's ridiculous for them to even say that. He has no right to do that. Anyway, we challenged his opinion and said we don't agree. And they went and sent it to another sham peer review with a bunch of orthopedic surgeons and neurosurgeons. And you could tell it was a sham peer review because they all wrote exactly the same thing. It was basically a paragraph that was written for them, and they just signed it. So they said, okay, look, we had a peer review done by a bunch of orthopedic surgeons and neurosurgeons, and they said this patient didn't need the surgery, so go away. We're not paying you. And I said, no, that doesn't stand with me. You guys did a sham peer review. It's not a real peer review. And your surgeons aren't even qualified because they don't do this kind of surgery. How could they say it's not necessary? They don't do it. They just made up a bunch of lies. Anyway, we took it to court and went in front of a federal judge representing Humana and the government. And she listened to our arguments for 3 days. And she did something I didn't expect. She actually sat down and listened and wanted to do what was right. Like, she actually wanted to do her job. And I was really impressed. So she heard 3 days of testimony. We had an expert. And in the end, they sent us a letter and said, you were right. It was a sham peer review. And we apologize. This is from the military, from the Secretary of Health. And he said, we did do a sham peer review. We apologize, and here's your money. And they paid us. But then right after that, Humana then said, well, no more Duke laser disc repairs. So we've not been able to treat our military since. And that's not right. The military agrees it's medically necessary. However, they've basically said payment for it will be $0. So how can we do it? Oh, anyway, just another fight we're going to have to fight later on. So we've done L23 on the left side. Now I'm going to do L23 on the right side. Let's get we got an AP view, right? Let's do another AP view. Let me know before you shoot it. You got it? Tell me when you're ready. Can you push that in? Thank you. Is that, go ahead. Watch your hand. All right, good. So our needle position looks perfect. So I'm happy with that. Go ahead and go lateral. The other day, somebody almost ran me off the road. I was pulling out of a parking spot. Literally, a quarter of my car was out, and I was turning, and this guy just flew past, like barely squeezing between me and the car on the other side. Almost hit my car. I mean, completely illegal move. Of course, I wanted to go find him, but my wife said, leave him alone. I said, listen, if we don't stand up against what's wrong, and fix it, it's just going to keep happening in the world. So as part of what we do here with our broadcasts, what's wrong is how people are treated with back pain. They have chronic back pain, and they're treated like there's nothing that can be done. That's wrong. It can be fixed. It just needs the right place and the right doctor to do it. Back pain robs people of their quality of life. Those people who suffer with chronic back pain, they can't do anything. They can't live a normal life that they deserve. And somebody like this commander, you know, they put in a lot of years of service, and now they're retired and they want to enjoy life. And they're not able to because their legs or their back are hurting from pinched nerves. We have to be able to provide a solution for them that makes sense, that's safe and affordable and effective. And that's what Duke Laser Disc Repair is. It's all those things, safe, affordable, and effective. And the alternative would be just live with it, which is not an option, or have major back surgery like you see up there, the screws and rods, which should be reserved for cases that don't get better with less invasive treatment, safer treatment. Shot? All right, so I'm making my way down once again through the foramen. Shot. We're at the back of the disc once again, and I can feel the herniation. I'm going to do the same thing here as I did before. Yeah, my anesthesiologist wants me to do a little testing first here. Should we do what he wants me to do? Oh, Luis. You're such a brown noser. Shot? But you know what? I'll do it. We're okay. Can I go? Okay, this will be our second side, our right side, same disc. This patient has pinched nerves, and that's his biggest problem. He also has back pain. You see that? When I did the injection of the dye, it lit him up. He had a 9 out of 10. So he's kind of minimizing the back pain. Doesn't surprise me. He's a tough old coon. He probably doesn't want to admit he's got bad back pain, but he does. And that's going to be gone after this surgery. He'll be happy. We do cure back pain here. Now he'll still have the other disc that needs to be fixed. That's the L12. But I think he wants to wait on it, and I respect that, so we're just going to wait. I think he's going to be happy with these results. I told him 70%. I think he's going to have a little more than that. But I always like to under-promise and over-deliver. It's just better. Dr. Carmody? 2007. Where is that? Do you know? Is that Maryland or something? All right, no problem. Thank you for doing that research.
Scope on, please.
You want to know, we have a great nurse here. I'm so impressed.
She's out in the packing right now.
Huh? No, we really do have good people here. I mean, it's taken me many years to find them. And it's hard to find good people. It really is. That live up to my standard. I'm probably the toughest person to work for. Maybe if this commander was working here, it may be tougher work for him. All right, there's the same thing. The herniated disc, we shoved it in. Now we're going to retrieve it. It is hard. Hard as a rock. There's a piece. Yeah, that's the beauty of the surgery. So for anyone who's thinking about learning this technique, you basically, it's incredible. You push the herniation into the disc, and then you take it out from the middle of the disc where it's safer. You're not working around the nerve root. So we do that with open surgery as well. It's a technique that I learned doing open surgery, open discectomy. Come on now. It's been a long day. Thank you for coming out. You want to see that? Let's take a look at that. Put the light on. Go ahead and take a look at this guy. Go ahead, Luis. Put that up there. You see that, folks? That herniation, right? You see it?
Yes, we can.
You see that's beautiful. That's what was pinching his nerves. So step 1, go in with a dilator and shove it into the disc space. Step 2, fish it out of the disc space. That's nice and elegant. Very safe for the patient. Pretty much done with that guy. I'm going to go in and clean this stuff up so it heals properly. All right, we need about 5 minutes. I expect 5 minutes. Okay, everything's okay. Just take it easy. Just lay still. You're doing great. I gotta say, I'm very grateful to my patients for allowing us to broadcast surgeries so the rest of you all can watch and learn from their experience what they go through. It's a very special relationship we have with our patients at Duke Spine. All right. Let's pull it back. There's really not much disc here. You all see that? It's gone. All right, what's obscuring your view is just some bleeding. No big deal. It's very mild, minimal. None of this stuff is very important. We've already gotten the big chunk out. Okay. He's just coughing a little bit. You saw that cough. There's another little chunk. Standby laser. This is a small one compared to what we've already taken out. I think we've gotten 90% of it right now. I've been doing endoscopic surgery on the spine now for 14 years. If you count my training, 15 years. It's funny because this technology is so advanced and so good for patients, yet so few surgeons know how to do it. You'd think they would figure it out like I did, right? You can think of it as being like total IV anesthesia. It's an advancement in anesthesia care. Or blocks. Any questions? We're just about done here. This is a bone spur, by the way, that I'm working on. I didn't say that earlier, but this kind of stuff like this, that is a little concrete patch, is a bone spur. He's moving around a little.
We do have a question.
Sure.
A viewer asks, how many levels can you do this on before you have to stop?
How many levels can I do it on before I have to stop? Well, typically I say four per patient. I can make exceptions depending on the patient. You know, lots of variables. Are they diabetic? Do they have high blood pressure? Do they have a good heart? We want to look at all those things. But generally you're looking at 4 levels. I just can't believe I did that. All right, I need to see this a little better. Oh yeah. Pretty cool, huh? Little herniation there. Take that. Well, hopefully you're all enjoying the surgery. I enjoy teaching. Yeah, see how the laser's so much better at some things? Laser. Can't really get that out with a traditional tool. But you sure can get it out with a laser. See, it's calcified herniation. That's what all that junk is. I apologize for the clarity of the view, but that's just some bleeding. It's just a little bit of red blood cells in the water. Kind of murk it up. Good thing is I've done this a few times, so I can work around it. All right, let's see here. Just about done, 2 minutes. A lot of osteophyte, a lot of bone spur. Really grungy stuff. This is what's been pushing on his nerve though. This and that other piece I got out. I've gotten out just about as much as I can get out here. I'm gonna do a tiny bit more and then we're done. We're just underneath his nerve root. This herniation goes from one side to the other, but the real pinching is happening in the lateral recess. So it's not my goal to take out any of the disc herniation that's not causing symptoms, because that's just gilding the lily. And we don't gild lilies here. We grow them. Anybody know what creature, what living organism has more DNA than any other on Earth? Anybody? Huh? What organism has the most DNA? The most genetic material? Right, we associate DNA with complexity of an organism. Anybody? Who's on the internet right now? Squid? No. Good guess. Luis. What is it? Chupacabra? A unicorn? Anybody? Anybody? What organism has more genetic material than any other? It's actually a plant. A plant. Nope. Corals are not plants, they're animals. It's a lily. The lily has more DNA than any other organism. Yep. All right. There's the nerve. Right over there, just north of us. In that little fatty thing right there. All right, we're done. Well, let's keep our fingers crossed. I think he's going to be happy. You never know. I will take questions if you have them. Type them up. You got 5 minutes to type up your questions. In the meantime, for those of you, turn off the scope please. Those of you who have never seen this done, take a look. Our blood loss was 5 mils. Take a look at the incision. Can you see this? Or is it too dark?
We can see it.
All right, that's my finger, right? So it's not even as wide as my finger. We did one on each side. Pressure. Great job, everybody, today. Thank you. I'm going to head over and do a quick 5-minute answer questions, and then we're going to see if our laser case that we already did is ready to go home, and if he wants to do a video. What is wrong with you people? We give you free live surgery of the spine and nobody asks questions. So disappointing. Well, we went from 100,000 views and took a nosedive to no 1,000 views. It's funny. Anyway, our patient's doing well. The laser surgery from earlier is already gone. He wanted to go home. He felt so good. He's like, I don't want to wait for Dr. Dugmajian, so he's gone. So we'll see him tomorrow. This current patient is a retired commander, I said? Colonel, retired colonel. And he's going to be heading home soon too, probably in about an hour. So I offer to answer questions for anybody related to medicine or spine or racing, if you want to know about racing. I can tell you that we will be back with you next week on Tuesday. We have some nice surgeries lined up already, and Thursday of next week. Well, maybe Tuesday. I have to look into Thursday, because I have to be out of here Friday.
It's just Tuesday so far.
Oh, just let's keep it that way. So I think we're doing a spinal fusion lumbar next week. Is that right? So you're going to get to see a lumbar fusion from the back. Anyway, go take a break. You all deserve it for sticking it out and watching surgery. I'm Dr. Ara Dugmajian. It's March 3rd, 2020. And we did some really nice surgeries today, and we're going to improve some people's quality of life. Have a good one.